In our new prevention center, what we're trying to do is we're bringing in patients who don't necessarily have heart disease, but they are at risk of heart disease, whether they have a family history or they have difficult to control high blood pressure or difficult to control cholesterol. And what we do is that we approach them in a global way. Our patients come to our clinic and they're first evaluated by a fitness specialist, exercise physiologist or a wellness coach that will evaluate the patient's activity level and their ability to do exercise and so on. Then they're evaluated by our dietitian, who will in turn look at their patient's preferences as far as diet and their dietary habits. They'll look at what they need to eat, why they shouldn't be eating, that kind of thing. And then after that, they come to us and we provide a thorough cardiovascular examination, and we do an evaluation of what specific tests the patients need in order to do what we call a cardiac risk stratification, so that we can tell a patient specifically what the risk of cardiovascular disease is and what steps to take in order to lower those risks. So in our program, what we use state-of-the-art imaging and diagnostic testing in order to individualize a patient's evaluation for risk. So we do tests like CT calcium score, carotid artery screening, ankle brachial index, or ABI, which is another way to evaluate subclinical atherosclerosis. In other words, we can tell if the patient is developing some blockages in the arteries early on, even before symptoms. And we combine that with state-of-the-art treatments that we now have available to treat these patients, from, like I said, non-statin therapies, which are specifically for patients who can't tolerate statins, to advanced therapies that we give injectables, infusions, and so on. So we have a comprehensive care center for our patients in order to prevent cardiovascular disease in the future. So we always encourage patients to talk to their physicians and to ask if the prevention center is good for them. We encourage primary care physicians to refer to us because we know that they're busy treating multiple conditions, and we can actually help them contribute to preserving the health of their patients by making sure they're achieving the targets, target blood pressure, target cholesterol, target A1C, and all those markers that we use in order to know the patient's particular risk in the future.